Introduction. Gabapentin is a medication frequently used in veterinary medicine, particularly for cats, to manage chronic pain and reduce stress, especially in clinical settings. Though its structure resembles gamma-aminobutyric acid, or GABA, gabapentin does not interact with GABA receptors. Instead, it functions by binding to a subunit of voltage-sensitive calcium channels which inhibits the release of excitatory neurotransmitters. Gabapentin is generally considered a safe medication with a wide therapeutic range and minimal side effects. The recommended dose range is typically between 10 to 50 mg per kilogram. Often, clinicians start at the lower end, around 10 mg per kilogram, and increase the dose based on the cat's response. While adverse effects are not common, sedation and ataxia have been reported. However, a more recently recognized side effect, myoclonus, has been well documented in humans. Myoclonus is a movement disorder that involves sudden, unexpected muscle jerks. Unlike other movement disorders, myoclonus is uncontrolled, brief, and has an abrupt start and end. Initial studies in humans estimated that myoclonus occurred in only about 0.1% of cases. However, more recent studies have reported a prevalence as high as 12.5 to 21%. The incidence of gabapentin-induced myoclonus is higher in people who have brain damage, epilepsy, or kidney disease. In these cases, a reduction in the dose is recommended. This article presents two cases of presumed gabapentin-induced myoclonus in cats. In both cases, myoclonic jerks developed shortly after the cats were administered gabapentin, and these jerks disappeared either when the gabapentin was discontinued or the dose was reduced. The authors claim this to be the first published report of gabapentin-induced myoclonus in cats. The risk factors identified in these feline cases parallel those described in humans. This information is highly relevant to veterinary clinicians who should be aware of the potential for myoclonus in cats receiving gabapentin, even at recommended doses. Future research should explore the role of chronic kidney disease and other neurological conditions as risk factors for the development of myoclonus in cats. The authors emphasize the importance of recognizing myoclonus as a potential side effect to avoid misdiagnosis and the unnecessary use of expensive diagnostic procedures or treatments. Study design and case descriptions. This paper presents a case series involving two cats that experienced myoclonus after receiving gabapentin. The primary goal is to describe the clinical presentation of this adverse effect in felines, which had not been previously documented in veterinary literature. The study retrospectively analyzes the cases based on clinical records and observations, and does not involve any experimental manipulation of the animals. The authors provide detailed histories, clinical findings, and treatment plans for each cat, emphasizing the temporal relationship between gabapentin administration and the onset of myoclonic jerks. Case 1 involved a 17-year-old female domestic shorthair cat that had been brought to the Ohio State University Neurology Service for evaluation after having 2 seizures within 6 months of each other. 1 year prior to presentation, the cat had a generalized seizure after receiving sedation. This was thought to be due to hypotension, as her blood pressure was very low following the event. 6 months later, the cat experienced a second seizure at home that was reported by the owner to last several minutes and included paddling, excessive salivation, decreased consciousness, and disorientation. Upon arrival at the hospital, the cat's blood pressure was recorded as 100 mm of mercury. A physical exam revealed no neurological abnormalities. Blood work did, however, indicate a mild elevation of lactate to 3.1 millimoles per liter, as well as azotemia, with a blood urea nitrogen level of 39 mg per deciliter and a creatinine level of 1.96 mg per deciliter. The cat's medical history also included a right nephrectomy due to renal carcinoma when she was 14 years old, and the cat was diagnosed with stage 2 chronic kidney disease, CKD, at that time based on the International Renal Interest Society, or IRIS guidelines. Her creatinine levels had remained elevated, often exceeding 2.1 mg per deciliter in subsequent blood panels. In addition, she had a pre-existing diagnosis of a ductal plate anomaly as well as a grade 2 out of 6 systolic heart murmur. The owners reported that the cat had not experienced any seizures or twitching since the second event, 6 months previously. To alleviate anxiety, the owners had been instructed to administer 50 mg of gabapentin, approximately 11.8 milligrams per kilogram, 2 hours prior to her appointment. A neurological exam found the cat to be mildly sedated with no other abnormalities. During the examination, however, the cat exhibited at least 10 myoclonic jerk events, each lasting about 0.5 to 1 second. These events involved rapid jerking motions of the head, sometimes side to side or up and down, and were associated with blinking, whisker movement, or head tilting forward or backward. Initially, focal seizures were considered, but the owners confirmed that the cat had never exhibited these events at home. Since a generalized seizure had not occurred for several months, the owners were instructed to monitor for any further episodes. 1 week later, before a follow-up veterinary visit, the cat was again given the same dose of gabapentin. At this appointment, she was once again observed to have brief intermittent jerking movements of her head. The owners confirmed that these events had not been observed at home between the 2 visits. A tentative diagnosis of gabapentin-induced myoclonus was made. The owner reduced the dose of gabapentin to 25 milligrams, or 5.9 milligrams per kilogram, before subsequent veterinary appointments, and reported that no further episodes were noted. Case 2 involved a 12-year-old female domestic shorthair cat that was brought to the Ohio State University Primary Care Service for routine dental cleaning. 5 years prior, the cat had been diagnosed with presumed primary epilepsy. At that time, her seizures were characterized by a brief preictal period where she would stare off into space before her face would twitch for a few seconds. The cat's neurological exam at the time was normal. Phenobarbital therapy was started, which decreased the frequency of seizures. However, this medication was discontinued due to adverse effects, and the cat continued to have brief focal events daily. The cat also had a 4-year history of iris stage 2 CKD, with creatinine levels greater than 1.6 mg per deciliter on several blood tests, but was not receiving any specific treatment for this condition. In preparation for her dental visit, the cat was given gabapentin, at a dose of 16.4 mg per kilogram, for anxiety prevention. While in the car, the owner reported observing multiple episodes of head bobbing, eye twitching and head twitching, occurring about once every 2 minutes. Upon arrival at the clinic, due to concerns of continuous focal seizure activity, the cat was given 3 mg of midazolam intramuscularly, or 0.5 mg per kilogram. This reduced the frequency of the episodes, and no episodes were noted during the anesthesia for the dental procedure. However, upon recovery, the episodes resumed and then eventually stopped later that evening. 3 days later, the cat was brought to the emergency room for an evaluation of hematuria. On exam, she was normotensive with systolic blood pressure measured at 110 mm of mercury. She was given antibiotics and prescribed gabapentin at a dose of 8.1 mg per kilogram, and then discharged. Once the gabapentin was administered at home, the cat started developing the same head-jerking episodes that had been observed during the dental visit. The owner also noted that these new episodes occurred much more frequently than her previous daily focal seizure events and happened intermittently for about an hour. The owner then returned to the hospital, where the cat was given midazolam and the movements subsided slowly over an hour. After this, the gabapentin was discontinued, and no further clustered twitching episodes were observed. Results. The primary findings of this case series are that both cats developed myoclonic jerks shortly after being administered gabapentin, and these events were different from their previously reported seizure activity. The first cat experienced head jerking that was associated with blinking, whisker movement, and head tilting. These movements were observed at the veterinary clinic after receiving a dose of approximately 11.8 mg per kilogram of gabapentin. When the dose was decreased, the episodes stopped. The second cat experienced episodes of head bobbing, eye twitching, and head twitching in the car, which started after being administered a dose of approximately 16.4 mg per kilogram of gabapentin. These episodes were reduced with midazolam administration, but resumed upon recovery from anesthesia. The myoclonic jerks occurred more frequently than her typical focal seizure events. Once the gabapentin was discontinued, the clustered twitching episodes were no longer observed. In both cases, the myoclonic jerks were associated with gabapentin administration and resolved when the medication was discontinued or decreased. The findings suggest a strong temporal relationship between gabapentin and the onset of myoclonus in these cats. There were no tables or figures mentioned or described directly in the text of the article. However, it does make reference to supplemental video material. Video 1 displays the first cat exhibiting myoclonus. The video shows the cat with sudden and rapid jerking motions of the head. It is clear that the movements are abrupt, brief, and cannot be controlled by the cat. Discussion. The discussion section of the article delves into the nature of myoclonus, the potential mechanisms of gabapentin-induced myoclonus, and the risk factors that might predispose cats to this adverse effect. Myoclonus can originate from the central or peripheral nervous system and can be caused by underlying conditions or external factors like medications. The condition can result from neurochemical imbalances, dysfunctional neural circuits, or damage to the peripheral nerves. Serotonin levels may also play an important role. There are two types of myoclonus, positive and negative. Positive myoclonus involves abrupt spontaneous muscle contractions, while negative myoclonus is caused by the sudden cessation of sustained muscle contraction. The cats described in this report seem to exhibit positive myoclonus, which includes head jerks. In humans, myoclonus has been associated with various medications, with gabapentin being a common culprit. Although the exact mechanism of gabapentin-induced myoclonus is not fully understood, the temporal link is well established and typically resolves fully when the medication is discontinued. The cases in this report suggest a similar correlation in cats, as neither cat had myoclonic episodes previously and the movements did not return when gabapentin was reduced or completely discontinued. Both cats had a diagnosis of iris stage 2 CKD. This is a common condition in cats, with a prevalence between 1 to 50%. Gabapentin is primarily excreted through the kidneys. Cats with CKD may have significantly higher serum gabapentin concentrations than healthy cats administered the same dose, which might increase the risk of adverse effects. Cats with CKD do have a slower excretion rate of gabapentin, but the full role of this on side effects of gabapentin is not completely known. It is worth noting that while gabapentin-induced myoclonus can occur in individuals with normal kidney function, people with reduced glomerular filtration rates have higher levels of gabapentin in their blood. This is associated with increased frequencies of side effects like ataxia, altered levels of consciousness, and myoclonus. Gabapentin-induced myoclonus can also be dose-dependent. In cats, higher doses seem to be correlated with an increased risk of adverse effects, particularly sedation. Case 1 had no further episodes of myoclonus when gabapentin was administered at a reduced dose, which is an indicator that myoclonus may be dose-dependent in cats as well. Dose reduction might be warranted in cats with documented CKD, especially when higher doses of gabapentin are considered. Both of the cats in this study had a history of seizures. Since neither cat had advanced imaging of the brain, the possibility of an underlying structural cause for epilepsy could not be excluded. In humans, both primary epilepsy and structural brain disease are risk factors for the development of gabapentin-induced myoclonus. The second cat continued to have isolated focal seizures after gabapentin administration was discontinued. However, these were consistent with the cat's prior seizure activity, and she did not have any further cluster events after stopping gabapentin. It is possible that another underlying brain condition may have contributed to the risk of gabapentin-induced myoclonus in both cats. Differential diagnoses for neurologic events such as those seen in these cases include focal seizures, dyskinesias, and tremor syndromes. Myoclonus has a distinct clinical presentation, but it can be confused with other types of neurologic events, especially if drug-associated myoclonus is not considered. Both cats were initially suspected of having focal seizures. It was only after a repeated association with gabapentin dosing that other possibilities were considered. The authors conclude that myoclonus is a potential adverse effect of gabapentin that has not been previously documented in cats. Future studies to better understand the pharmacokinetics of gabapentin in cats with various levels of kidney function may help determine which cats are at a higher risk for developing myoclonus. They recommend adjusting gabapentin dosing for cats with documented CKD and potentially also for cats with intracranial disease, and clinicians should be able to recognize the difference between gabapentin-induced myoclonus and other neurologic conditions to prevent misdiagnosis and the unnecessary use of costly diagnostics or improper treatments. Gabapentin is an important tool for managing hospital anxiety in cats, but care must be taken when prescribing this medication to patients with the conditions that were discussed in this case series. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.